A doctor didn't take a proper history. This is what happened to the patient. JL, a 45-year-old man living in a small town surrounded by dense forests. He is an avid hiker and often spends his weekends exploring new trails. On one sunny day, he decided to hike a trail that hadn't been on in years. The path was surrounded by tall trees and the sound of chirping birds filled the air. As he trekked, he felt a slight pinch on his leg but dismissed it as a thorn prick. A week later, JL started feeling unwell. He experienced fatigue, headaches, and a loss of appetite or hunger. Thinking it was just the flu, he took over-the-counter medications and rested. However, 3 days later, he developed severe abdominal pain and began vomiting. Concerned, he decided to visit the local emergency. Upon arrival in the ER, it was busy. The doctor was swamped with patients. When JL was consulted, the doctor noticed that JL was overweight, and without doing much in the way of history or physical exam, he quickly assumed that it might be gallstones or gastritis. These are conditions that are common in people with obesity. He prescribed painkillers and antacids, advising JL to consider a healthier diet and lose weight. JL, upon trusting the doctor's expertise, went home hoping for relief, but his condition worsened. 2 days later, he was back in the ER. This time, he was barely conscious, with a purple rash spreading across his legs. What is causing this rash? A different doctor now took over the case. The doctor immediately ordered a series of tests and took a detailed history from JL's family. They mentioned his recent hiking trip, and the doctor's suspicion grew. The doctor thought of Lyme disease, a bacterial infection that is transmitted by ticks, which can present with GI symptoms or stomach ache in its advanced stages. Blood tests confirmed her suspicion. JL was immediately started on a course of antibiotics. The doctor explained to the family that if Lyme disease is caught early, it is treatable, but delayed treatment can cause severe complications. The oversight by Dr. Smith had caused a critical delay in JL's treatment. If he had taken a thorough history and performed a physical exam, he might have noticed the early signs of Lyme disease, and JL could have been treated days earlier. This case serves as a stark reminder of the importance of detailed patient history and physical exams. Assumptions in medicine, no matter how experienced the doctor is, can lead to misdiagnosis, delayed treatments, and even severe consequences for the patients. It doesn't hurt to spend 10-15 minutes extra on a patient just so that you can understand what the patient is going through, empathize with the patient, understand the symptoms properly, perform a thorough physical exam, and that way you can skip most expensive tests or even not worry about it, and the disease might not be anything at all, which could have been prevented if the patient took proper precautions and it wouldn't require any treatment. People generally are anxious in a hospital, and if a doctor who doesn't communicate properly consults them, it basically feels like they are being alienated, and this causes the patients to not follow up on the therapy or to lose for follow-up and seek for alternative medicines that may or may not work, and then end up with even severe consequences. By then, it might be too late. It is always imperative to perform a proper history and physical exam, and I have seen many doctors do it the right way. One of the first things that we were taught in med school is how to perform physical exam. Anyways, thanks for watching. If you like this video, share and subscribe, and wait for more.